Good morning. Thank you for being here. I am Professor Lisa Glegg, and I teach economics in the social science department. And you are here for one of our sessions of the conference on race, ethnicity, and identity. This started last week, and it will go through this week. So we've got a lot of great events, several events tomorrow, and there are events tomorrow night, Wednesday night, and Thursday night. So there are lots of different great lectures for you to hear. So one thing I wanted to make sure that you were aware of, some of you may have seen Michelle Norris last week, part of the Diversity Lecture Series and our conference. And if you hadn't had an opportunity to fill out a race card, we have some of those in the back. Or after the conversation today, if there's something that's brought up that makes you want to fill out one of those race cards, you can find one of those on the back table and turn that back into us. So today, you have the great opportunity here from Professor Cedric Williams, who's a professor of sociology in the social sciences department. And he will be talking, and then there will be an opportunity for questions. So while he's talking, if you find that you've got a question, jot it down, and there will be a chance to ask it at the end. So please join me in welcoming Professor Williams.
Thank you, Lisa. Hopefully this mic is working properly. Good morning, ladies and gentlemen. Hopefully all of you are at least going to get extra credit for being here, or at least something monetary or something like that. I don't have any personally to hand out, but I'm hoping you're getting something out of this other than just being here for the sake of being here. Today I want to talk a little bit about disabilities, because this is one of the areas in which we here at Grand Rapids Community College, as well as around the world, have been dealing with disabilities because they have become much more pronounced. They have become much more, or people have become much more aware of them. And so therefore, we're finding that today, it's an important concept that we need to pay very close attention to. For a short time today, I'm going to talk about a few things, and I don't want to bore you, and I'm not going to hold you too long, but I want to try to address the historical issues, the invisible disability identity, what are the causes, the common disabilities that are out there, deal with disabilities in terms of at home, school, work, friends, some of the myths about disabilities, some of the emotional effects of disabilities, some of the current statistics, and some of the things that we can do to bring about a change. I don't usually like to wait until the very end to get questions, so if you feel that you need to ask a question, feel free to do so at any time. We've got mics, so you can always feel like you can participate. I'm not really a stickler in terms of formality, except in emails. Other than that, I'm not very formal at all. So let's get started. When it comes to disabilities, you need to understand that disabilities are things that a lot of people have. I personally am sitting down because I happen to have 2 disabilities myself. And the reason I'm doing it on a disability is because a lot of times people misunderstand what disabilities really are, how it affects people, the impact it can have on people. And so my disabilities are 2. I have disabilities in terms of my knees and in terms of my eyes. I wear glasses that have prisms in them. And those prisms cause my eyes to come together because I don't have the ability to really focus the way I really need to. So my eyes don't really work well that way. So that's why you'll see me sitting down more than standing up. But my disabilities, I work around. But in many ways, my disabilities have become my identity. And we're going to talk about that a little bit. But let's start with how people are viewed that typically have disabilities. Many times we view people that have disabilities, and especially if they're invisible disabilities, they have been feared, they're misunderstood, they're looked down upon. Many times these individuals are made fun of, they're stereotyped, they're avoided, all of those different kinds of situations. And one of the things that we want to try to get out of today is the fact that you really don't need to avoid people. Science has made it possible for people like myself to do quite well, in fact, even with a disability. You can have replacement knees, you can have replacement hips. There are people who have learning disabilities, asthma, bipolar disorder, brain injuries, et cetera. So it's a myriad of disabilities that are out there. Sometimes people have been viewed as being lazy, or they're faking an illness, or they're trying to get out of work, or they want to get something for nothing, or trying to gain attention or sympathy. And so people sometimes are made fun of, even though people are not aware that they happen to have disabilities. And those disabilities can be, in many instances, disabling to the point where people cannot do anything. And because of those stereotypes, people are once again made fun of, looked down on. But there are a lot of people throughout history who have been quite remarkable people who have had disabilities. Einstein, for example, was not able to read until age 9. Walt Disney, Rockefeller, as well as others, have had difficulty reading all their lives. And so there are a lot of people that are out there that have difficulty or have had difficulty and still made a great impact in terms of the society. You say, well, why are you telling us all of this? We're aware of all of this. Well, this is really just an opportunity for all of us to come together so we can understand one another even better. Today, we live in a society where people are being asked to be more inclusive and accepting of people of all walks of life, not only race and ethnicity, but also identity. And identity can be one of those things that sometimes is quite difficult for us to put a nice label on, but it still means that individuals still are human beings and deserve our respect and understanding no matter what. Well, what's a disability? An invisible disability is one that ultimately, according to the ADA, is going to affect people so that their life experiences, their life happenings every day, all of those things are going to be difficult for them. It's something that you can't see. Asthma, for example, unless you hear a person breathing or you know that they happen to have asthma, those individuals you might not ever know unless they were having an asthmatic attack. Bipolar disorder or brain injuries or sleep disorders, narcolepsy, things like that. You might not even know that a person has it, but it's not important that you know that they have it. The most important thing is that you learn to respect them, to understand them, to be patient with people who have disabilities. And disabilities are not always that obvious. I know sometimes I'm driving my car and I get out of my car and I close my door, and all of a sudden I see people looking at me because I'm parked in a handicap spot and I have a handicap sticker, and I'm not that old, so they're wondering, why in the world is this guy parked in a handicap spot? Is this his car or somebody else's car? Or I don't see a cane, I don't see a wheelchair, I don't see anything. And so people are wondering, do you really have a disability? Well, when people have a disability, these things can cause you to have difficulty in learning, communicating, to behave properly, to understand what's actually being said. I remember being in a meeting with one of my colleagues, and he was looking at his paper very closely, and it was like right in front of his face. I was not aware that he had that disability until I actually saw that, and we had a chance to talk about it. But it's still about being patient and understanding of individuals that have a disability. So these conditions will affect people for in some instances, all their lives. In other instances, it might be a temporary disability, and it might actually cause them great pain and anguish and problems in terms of everyday functioning. One of the other difficulties that you might see is that there's no cane, there's no identifying marker. If you saw me somewhere, you would not know that I had the disability. You would say, yes, he's wearing glasses, but you typically would not see my prisms because they're not that thick. So therefore, you might not even know that I happen to have a disability. Some of my colleagues might not know, but I've said to them, or maybe they don't remember, but I have said it to them that I do have a disability. In fact, I have a couple, as I've stated. But if you don't see a cane, you don't see a wheelchair, you don't see sign language being used, you might be thinking, well, these people really don't have a disability, so therefore they should be viewed and treated as normal. And many times people who do have disabilities operate out of fear, maybe even being treated unfairly, depending upon what their disability happens to be. So an invisible disability is one that you can't see. There are no supports whatsoever. It can be permanent or temporary, and it can be managed in some instances through medication, in other instances behavior, depending upon what it is. Diabetes, for example, you can control with diet, but you can also do it with insulin. Asthma can be done with medication. Epilepsy is same as psychiatric disorders as well. So it's an invisible thing that we're not always able to see right up front. And so what's important for us is to understand and maybe even ask questions rather than to make assumptions. Because when you assume things, you many times make mistakes and you cause difficulty and problems for yourself as well as for others, okay? Now, the only downside of some invisible disabilities is that in order to receive accommodations, they must, please note this, they must be documented disabilities. If, for example, as I told you, my knees and my eyes are my problem, if they're not documented, then I would not get what's called a reasonable accommodation. This is where if you need additional time for taking exams, if you need additional time for studying, if you need someone to read to you, or you need someone to take notes for you, as long as you can document it, then from our DSS office, then you can get assistance. That's, once again, in my opinion, that's the downside. All disabilities will not be documented, but some people still have disabilities and should be given certain accommodations. But according to the ADA, the Americans with Disabilities Act of 1990, it just means that you're going to have to document it. So in my classes, if you have a disability, I can give you additional time if you go to DSS and you do have the appropriate paperwork, then once again, we will make those accommodations. We're seeing now, for example, even in videos or movies that might be shown in a classroom, they now have to be closed captioned. You just can't show the movie anymore because you might have students who have disability with hearing or disability with seeing or whatever it might be, so that they might be able to read or have someone read to them. Individuals, for example, that might be blind happen to have readers, so if they're using a computer, they're able to have that reader talk to them and tell them exactly what's on the screen. So these individuals are going to have accommodations made by whatever the institution happens to be, depending upon how severe the disability happens to be. The person is going to, of course, be in some kind of physical or emotional pain. A lot of times I'm asked, how much pain are you in? Mine is constant. It's 7 days a week, 24 hours a day. It doesn't let up. It's always there. So even if I happen to be able to sleep, it's still going to be difficult for me. For disabilities, there are some people who know they have disabilities, which is a challenge. Some people don't know that they have disabilities, or in fact, identify themselves as having a disability. And I don't know if you've ever met people who have a disability, but they don't want anybody else to know. They don't want, I don't care who it is, I don't care what it's about, don't tell anybody about my disability. Why? Fear. They do not want to be stigmatized. They don't want to be marginalized. They don't want to be treated unfairly. They want to be ultimately treated as normal, so to speak. So they may have been diagnosed with a disability, but they might not have been diagnosed with a disability. Some people know what they need, but are unable to get it. They don't have the money. They don't have the health insurance. They don't have the ability to ultimately get what they actually need. For some individuals, they even have difficulty articulating it or telling or specifying exactly what the disability is. For years, people were complaining about chronic fatigue syndrome. And people were saying, it's in your head, I don't know what you're talking about, this doesn't exist, and we find out that people actually do suffer from these kinds of disabilities for sure, and it is real. It's not something that's made up. People feel like they might be misunderstood, they might be ignored, invalidated, marginalized, as I've already said. And so they might know what's going on, but they don't know how to fix it, okay? And so for us, the important thing, once again, is our respect, our understanding, and our patience. Well, what are the causes of invisible disabilities? The causes are myriad of invisible disabilities. Some people are born with them. People are born with spina bifida. Individuals are born with difficulty walking, they have difficulty talking, difficulty reading. So learning disabilities as well as other disabilities also might have been born with those. Others, they've had an accident that caused their disability. Mine is just the cartilage in my knees have started to wear out. And so at some point, my doctor tells me that I might need to ultimately do a knee replacement, or in fact, 2 knee replacements. And because we are exercising more, we are active more, we are living longer, more and more people are having knee surgeries and hip surgeries and all kinds of repair of those disabilities. Age might also cause those disabilities as well. And so you have to understand that you, when I was 21, for example, had no disabilities, none whatsoever. But over time, those disabilities have started to show up more and more. And so with the 2 that I have, thank God I've only got 2. I don't know, maybe some of you have disabilities as well. I don't know, I see some of you wear glasses. I don't know if anybody else wears prisms or not like me. Some of you might be wearing contacts and you don't want anybody to know that you wear glasses or that you have difficulty with your vision. Some of you might also have learning disabilities and you don't want people to know about those learning disabilities. If you do a lot of research on disability, you'll find out that in academia, there are a lot of people that actually have disabilities. And those disabilities can work against you, but they can also work in your favor. So it's not only caused by the things that are on the screen, there are other possible causes for disability. Sometimes it's caused because of our own behavior. Our diet has caused our disabilities. Our social expectations, for example, bulimia might be caused by our social expectations within the society at least. Anorexia being another one that might be caused by social expectations as well. Now, there are different types of disabilities that are out there. There are physical disabilities, mental disabilities, developmental disabilities, as well as other disabilities. Let me start with the other disabilities, which is actually things like senility. Alzheimer's might fall into that category as well, where it's not visible and you don't actually know that I'm actually senile while I'm sitting here talking to you because I have a script that I'm following. But if you were to talk to me after class or after this session, then you might say, that guy's really senile. Well, you might know it then, but because I'm following a script, you don't know that I'm actually senile. You also don't know that I might be dyslexic. And so by having it in really big print so I can see it, not just so you can see it on the screen, but so I can see it and I can follow it, it might actually come across if you came and talked to me after the session was over. So the other disabilities are sometimes there, but once again, we don't always make people aware of those disabilities because, once again, people sometimes are afraid to let people know. Physical disabilities, those would be my knees, the inability to walk, the inability to get around on your own the way you would like to. So those are physical disabilities. Mental disabilities are learning disabilities. They could be other things that you can't remember things. And I know everybody forgets something at one time or another, but you can also have mental disabilities in terms of not only remembering, but difficulty doing certain things that you don't normally do, for example. Somebody asks you to do something that's outside of your routine, and therefore you find it difficult to do that because it's not something you do on a regular basis. Developmental disabilities are going to be disabilities where there is some kind of difficulty in terms of cognitive processing. You might find individuals that didn't grow properly, and so we call them little people. Sometimes the concept of dwarfism might be used. Developmental in terms of they might have a cleft palate might be one thing as well in terms of developmental disability. I was reading the news and there was a baby born in India that was born with two heads. And so you've got one body, but you've got two heads. That would be a developmental disability. And so there are other disabilities that are out there. Just to give you an idea, this is the types of them, but the common disabilities are the ones that are going to be on the screen here. Some of these you might be familiar with, some of them you might not be familiar with. ADHD, anxiety disorders, Asperger's syndrome, bipolar disorder is another one. Brain injuries might be another one as well. Charcot-Marie tooth disease, and that's not dealing with your teeth. These are the names of the individuals who discovered this. Okay, so it's not dealing with the mouth at all. Circadian rhythm sleep disorders, depression, diabetes, epilepsy. All of these are invisible disabilities. Fibromyalgia, or you might know people who have fibromyalgia, okay? Pain in the joints, difficulty moving. I have a friend who has fibromyalgia, and they find it very difficult to get up in the morning and get moving because of the stiffness and the pain in their joints and trying to move and to get around. I'm not going to go through all of these. Hypoglycemia is another one. inflammatory bowel disease, lactose intolerance, metabolic syndrome, migraines, narcolepsy. Narcolepsy is going to be one that you'll find that people tend to sleep a lot. And so you'll find that people that you might be talking to will hum while you're actually talking to them. I have a friend in Indiana who has narcolepsy. And the first time I met him, he was humming while I'm talking to him. And I'm thinking, this is really rude. This is rude. And I'm having a conversation with a person and they are humming. And I found out that they do that in order to keep themselves stimulated, because if they don't, they might just fall asleep and they would fall down, hurt themselves. And so they've learned certain tricks of the trade so that they don't harm themselves and don't hurt themselves at all. So the humming is the thing that will stimulate them. So I eventually got over that and learned how to deal with that. But I didn't know that he had narcolepsy. I also found out that his father had narcolepsy and that it was transmitted to him from his father, or at least on his father's side of the family at least. There are others that are out there. Personality disorders, psychiatric disabilities, depression might be one of those, mood disorders, personality disorders, other psychiatric disabilities, schizophrenia might be one. Another one might be where individuals who are suffering from Alzheimer's don't have the ability to recall, remember, retain information in terms of their long-term memory, but everything's short-term. And once they state it, or once it's said, it's gone. And you might ask them later on, what's today's date? What time is it? Who certain people might be, because they have difficulty understanding or recalling that information. Scleroderma, ulcerative colitis. And so you've got a lot of invisible disabilities that are out there. And some of these are going to affect people for the rest of their lives. There's no way to get away from them. There's no way to get around them. It affects them at home. It affects them in school. It affects them while they are with their friends. You find that they might have difficulty in a classroom. They might ask the teacher to explain something over and over and over, and they might have to ask the question repeatedly in order to get the understanding, while we're saying, man, don't you get it? Don't you understand? So you might find somebody who's a little more impatient in school or at home or even with friends. They have difficulty writing clearly and putting their thoughts in a very clear and concise manner. So they have a hard time learning some subjects, especially when it deals with reading and with math. I've already mentioned dyslexia, which can also be a difficulty as well, but don't feel bad for people that have the disability. Try to understand people and respect them no matter where they are, whether it's at home, whether it's in school, or whether it's with friends. Well, there are a lot of myths that are out there about these disabilities. One of the myths is that individuals with disabilities cannot learn, and that's definitely false. People, in fact, the research shows that many people with learning disabilities, in fact, are quite brilliant, in fact. So don't think that individuals who have them, regardless of what the disability is not able to understand, or they're not able to comprehend. It's that they might have difficulty grasping it, but once they do grasp it, they've ultimately, they've got it. And so I find that dealing with individuals with disabilities, if I am patient with individuals and I am respectful with individuals with disabilities, then I find that ultimately students or whoever you come into contact with are able to learn, they're able to comprehend, they're able to be successful in terms of learning and being successful in whatever the class that they might be in. Some people might believe that it's an excuse to act irresponsible, lazy, or ignorant. Okay? It's not. It's not a game. It's not a ploy. They're not doing it out of ignorance. They're doing it because it affects their everyday lives and their everyday dealing with everyday life. So they're coping with the situation in the best way possible. Not that they are lazy or ignorant. The others is another myth. They go away in time. You grow out of them. That is also false. Disabilities typically are going to be with you for a very long time. And for most people, those disabilities are going to be with you for the rest of your life. The disabilities are all the same. So because I have problems with my knees, everybody who has problems with their knees act the same way. Not at all. They conduct themselves the same way. No, they don't. People who have problems with their knees, sometimes you have people who have one knee that's a problem. Others who have knee problems with both of their knees. Then you have people who have hip problems or other difficulties as well. And so while they might have been born with it, they had an accident, they had an illness that might have caused it, it could have been a brain injury that ultimately caused them to have that disability. It might have been a problem with their cerebellum or some other kind of brain injury or location in terms of the brain. It only affects one aspect of their life. My disability affects every aspect of my life. My daughter is 5.5 years old, and so she wants to go outside and play, but I'm limited in terms of how much playing we can do. She can fall on the ground, and it's not a problem. I'm not falling on the ground. I fall on the ground, I might not be getting up too soon, so I'm less likely to fall on the ground and just let her fall. And then make sure that I can pick her up. But it affects every aspect of your life. You will find that people who have disabilities, once again, in many instances want to hide those because of, once again, fear, shame, don't want to be treated differently than other people. And so they want to be just like everybody else, or at least to be considered as normal, okay? So the first myth is that people with learning disabilities are not smart, they cannot learn. In fact, the research says that most of these individuals are in fact quite gifted, and you can go look at some of this yourself. They're above average intelligence. Gerber, in terms of their research in 1998, found that that's exactly the case. They are not less able, they're in fact more able than, and above average more than the average individual. So with the proper tools, with the proper understanding, with the proper treatment, they can be successful in school as well as other aspects of their life. The disability is that children won't succeed. That's also false. Children are going to succeed if they're given the help that they need. Children, for example, who are born with Down syndrome can do more than we many times give them credit for. But you have to start very early with Down syndrome in terms of treating Down syndrome, teaching children that have Down syndrome how to deal with it, those who have autism, those who have Asperger's syndrome. And they're going to do well as long as they're given the assistance that they need in terms of learning. The last one, they're like a disease and can be transferred. So people are afraid of, if I get close to this person who has this particular disability, I myself might catch it, and I don't want to do that. I remember when I was growing up in Detroit that when I jumped into the pool, the belief was that my skin color might come off, and people who were very fair-skinned got out because it could come off and float over to them, and they could therefore become my skin color. So yes, it's ignorance that's involved in terms of disabilities as well as in others as well. And so all of these are myths that we need to understand that we can actually overcome all of these things. The difficulty is the emotional effects. The emotional effects cause people to be very ashamed of their disability. It's almost like it's hidden. It's in the closet. They don't want anybody to know. It's almost like people who have been gay in the past and they didn't want their parents to know, didn't want their friends to know, no one to know. So sort of being in the closet. Well, invisible disabilities in many ways are that way as well. People are ashamed of having that disability, and therefore they make excuses for why they are doing the things the way that they're actually doing them. They are ashamed of their behavior. They might feel embarrassed because of it. They don't do as well as others in school in terms of that conversation that they might be having. They might do quite well in terms of the writing, but not in terms of the ability standing up in front of a class and giving a presentation. They hide their differences because they don't want to be ridiculed. They don't want to be labeled as being stupid or lazy or any other negative terms you might want to be applied to them. They don't want anyone to know because of all of these things. And that shame can cause them to, in many ways, isolate themselves from others so that no one else will ever know. Fear is another difficulty and an emotional effect. People with these disabilities many times are afraid that they will be looked down upon. They will feel very uncomfortable, marginalized, talked about, especially behind their back, and are always afraid that they're ultimately going to be found out, that they do have this disability, and it might change how people actually treat them and talk to them and deal with them. I'll give you an example. Have you ever noticed sometimes when you're talking to someone and they might not speak your language very well, so we think if we speak louder, they're going to get it, okay? Do you understand what I'm saying? Oh, well, that just cleared it right up for me. It doesn't, but people are afraid that if they speak in public many times that they're not going to be appreciated. People are going to say, I can't understand exactly what they're saying or what they might mean. They might feel like they're going to be rejected, afraid of building relationships because they don't want to share with anyone what exactly is going on with them. They're self-conscious about it to the extent that they always try to prepare themselves before they go or sort of psych themselves up so if anybody sees what's going on, that they can hide it in some way. And so they are very self-conscious about that. For me, I don't care. You can know about my knees and my eyes, that's fine. You like me, fine. You don't, fine. I don't care. Let's move on. But other people feel that way. Sometimes, I don't know if you've ever seen people who have a limp when they're walking, and it might not be an obvious limp, but they don't want anybody to really notice the limp. And so they try to walk in such a way so it is less visible. Some might feel stigmatized, so that they are not going to be offered a job because of their disability. They're stigmatized in such a way that they are going to be viewed as being less intelligent, not as smart. They're going to be talked down to, treated like a child rather than like an adult. So you find they have low self-esteem. Sometimes you'll find people with that. So they sit in the back of the room. They don't want anybody to see them or to notice them or that they have that disability. They have been treated with negative behavior in the past, and so in many ways, before they go to activities or to the park or whatever it might be, they prepare themselves for how people might treat them or how they might be received. People with disabilities are sometimes pulled on and tugged at and made fun of and belittled, and so they will try to hide their disability as much as possible. And the big one is the unfair treatment that they ultimately might receive, and they don't want to be treated unfairly. The only thing that people with disabilities want is fair treatment and an opportunity to actually participate equally with everyone else, a fair chance at the job. Forget my disability because I can't walk. I'm a sociologist. I know sociologists. Not only do I have a bachelor's degree, but I have a master's and I also have a doctorate. So because of my disability, it doesn't slow me down any in terms of my achievements. And so you find that people with the disabilities might feel like they're going to be treated unfairly. But if we are very respectful of individuals with disabilities and we are fair towards them and we're patient and understanding, people with disabilities, in fact, will do quite well within the society. Just to give you a few statistics, nearly 1 in 2 people in the U.S. has a chronic medical condition, okay? That's 50% of the U.S. has a chronic medical condition of one kind or another. That's a huge number. That's somewhere in the neighborhood of about 150 million folks who have a chronic medical condition. Most of these people are not considered to be disabled. Interesting. But they have a chronic disorder. But they're not labeled as being disabled. Okay? Remember, I told you under the ADA, it must be documented. Okay? And even though they have this disorder, or even though they're not labeled this disorder, it doesn't impair their normal everyday activities. Nothing slows me down. I still do my work. I still do what is necessary. I still walk. I still talk. I can still think. I can still do everything that everybody else does as well, even though I happen to have a disability. People that do have disabilities sometimes have assistive devices, okay? But other than that, you wouldn't know it unless you saw them at home, for example. Remember, I was saying that you might have a reader so that you can actually see, or hear what's on the screen rather than actually seeing it. But most of the time, we say people are not disabled unless we see a cane, okay, and it's a red and white cane, or you've got a dog or something that identifies you as being disabled. And you don't really need anything to say that you're disabled. All you have to do is to identify yourself as being disabled and having a disability, whether it's documented or not. 96% of people with chronic medical conditions live with an illness that is invisible. So most of those folks have an illness that no one else knows unless they decide to divulge it to someone else, okay? And it's estimated that 10% of the people in the U.S. have a medical condition which could be considered a type of invisible disability. That's a huge number as well. That's somewhere in the neighborhood of about 30 million folks. It's easy to see people in a wheelchair as being disabled. Real easy, piece of cake. All right, we know that they're disabled. So we will then give them room. A person in a wheelchair, for example, we will allow them to go in the door first, maybe. We might make room, hold the door for them, do other things to assist them. But if we don't see that cane or that wheelchair, we might not be willing to do that. Some people living with those disabilities might have a mental challenge. We've talked about learning disabilities already. And sometimes you need to explain things to people. It could be age-related. So I might not hear as well as you hear. I might not see as well as you see. But if the print is large enough and it's right there in front of me, I'm able to see it. Therefore, I can participate just as well as anybody else, regardless of where I'm sitting in the room. So there are accommodations that we can make. If you notice, last year when I did a presentation on race and ethnicity, they didn't have a chair available for me. This year they do. So last time I had to, I wasn't on camera last time most of the time. Most of the time I was sitting on the side because they did not have an accommodation with a chair for me to be able to sit here and to do my presentation. This year, it is available. So that accommodation assists me in being able to do the work that I need to do, and therefore I can function. Well, how does the disability identity develop? Well, from a sociological perspective, what happens is my disability I internalize in terms of my inability, for example, to run to the back of the room. So because of my knees, I can't run as fast as you can. And so if they said fire, I'm not going to that door or that door. That's the closest exit for me. So I'm headed outside going that way. Well, you might be able to move faster than I can move, but it doesn't mean that you're going to be better at doing anything that I do other than, say, running. Okay? And unless it's a marathon, it really doesn't matter anyway. As long as I get outside in case of a fire, and you get outside in case of a fire, it doesn't matter who gets there first, as long as everybody gets out. Okay? So when you're talking about a disability, people tend to internalize this. So that label becomes a part of them. So my knees have an effect on me every day of the week. So my daughter knows that I have difficulty with my knees. So she'll fall, but I won't fall with her. Well, that's okay with her. She doesn't care. As long as I'm playing with her, she's satisfied. Okay? So it becomes internalized because of the fear, the stigmatization, the low self-esteem in some instances, and people are afraid to self-identify. I've had students in classes who have disabilities, but they don't want anybody to know that they have those disabilities. You say, well, why not? If you let me know that you have those disabilities, I can assist you. I can make sure that you get the assistance that you need, the help that you need to be successful. So that means that I can give you the additional time. I can make sure that you get it either in audio form or in ebook form or whatever form it takes so that you can be just as successful as any other student in the class. So it really doesn't matter that you have a disability in terms of you being successful. You can be just as successful as any other student in the class that has a disability or doesn't have a disability. Individuals tend to believe the label that's been assigned to them by the society. And this is one of the difficult parts. From a sociological perspective, once you're labeled with something, it's hard to get away from that label. I don't care what the label is. If people say that you are a slow reader, from now on, it will pass from teacher to teacher to teacher to teacher, from student to student to student to student, from friend to friend to friend, that this person is a slow reader. This person has this difficulty. This person has that problem. And so many times it follows you no matter where you go. It's almost like the concept of once a criminal, always a criminal. So you're not allowed to change or to get better. You're always thought of in the negative rather than in the positive. And so that labeling, in many instances, becomes self-fulfilling. Okay? I don't know if you're familiar with it or not, from the self-fulfilling prophecy concept, that you, because of that label that's been applied, or you apply to yourself, you begin to act that way, conduct yourself in that manner, with the expectation that everyone else treats you that way. Well, remember now, I have this disability, so I don't want to walk to that back door, so would you mind getting my briefcase for me? And so I might use that rather than to do it myself as much as possible. I might want to make people feel sympathy towards me. I might want to make people feel bad, because they might have made fun of me or treated me wrong or whatever. But it comes about in such a way that in many instances, I might bring it upon myself, the label might bring it upon me, others might label me. So it's not just a function of me doing it to myself, somebody else might label me, okay? Whether it's true or not doesn't matter. So if you see me walking with a limp, or from now on you see me in the hallway, and now that you've seen me, you say, oh, this guy's got a disability, so therefore let's treat him differently because of that disability. That's not fair and that's not right, okay? That's disrespectful of individuals in terms of their humanity. And so what should we do? We should be very patient, understanding, caring, and treating everyone in such a way that they are treated equally. Lastly, what can we do? How do we go about bringing change? The way to do it is to ultimately do the three things that are on the screen here: respect, learning, and interacting. The more that you respect people, the more that you learn about disabilities, the more that you interact with people with disabilities, the better we will all be as a society. How can we help? This way. You ask before you help. I don't need help getting to my car, okay? But it's okay to ask if I need help. Secondly, if you're going to talk to someone that has a disability, speak very clearly and directly. And lastly, be respectful, understanding, and patient. Thank you. Have you got questions for me? Anybody? Yes, ma'am. I can walk back there to you. It's okay. Because they want to get you on the camera, I'm sure, so. Okay. No, never mind. They won't. They'll just put your voice on it. Okay. Nobody will know you're here. It's okay. Okay. Can you push the button and turn it on there?
Okay. For like in the classroom,
right.
What do you suggest if someone like needs more time? Because I know back when I was in school and I am not the best test taker, they would just read it to me in the room with everyone else. And you talked about how, you know, you don't really want people to know that because then, you know, you're taking the easy way out or whatever. And what do you suggest, like, how to deal with that or how to make it knowledge to schools of that's not how to treat a disability?
First of all, you always go talk to whoever your professor is. It really doesn't need to be divulged to anyone else other than whoever the professor is that's teaching the class. You go to them, they will advise you to go to, at least here, DSS, and if you can document it, then automatically we will give you the additional time. And the reason that we do that is that the rules are, at least in terms of the college policy, that we have to know that you happen to have that disability. Now, in the past, before ADA and all of the focus on disabilities, a student would say to me, I need additional time, then I would automatically give that student the additional time. But the rules have changed since that time. Now you've got to go to DSS. They have certain forms that have to be filled out and all of that. But you do have to talk to your professor in terms of that, and then you can take your exams, for example, in a separate place altogether. Nobody even needs to know if you don't want to self-identify. And in some instances, people don't want to self-identify because of the reasons that we've talked about already, which is the fear and the shame and being stigmatized or marginalized. And the other thing is, if we were really honest about it, a lot of people that we're in class with have disabilities, but nobody wants to say anything. Okay, so, and in fact, if we were to talk in this room, we've got people in here with disabilities, but nobody's like, hey, I got one. Okay, nobody's like that, but everybody wants to identify with something else, but not with a disability. So first of all, talk to your professor, okay? Secondly, you're going to go to DSS. Once it's documented, then they're going to give you the additional time, and you can do it somewhere else other than in the classroom. You can actually do it over in student services, where you can, or in the DSS office, where you can actually take the exam. If you need somebody to read it to you, they can read it to you. They can explain it to you. They can't answer it for you, but they can make all of the reasonable accommodations possible. Yeah. Any other questions? Yes, ma'am. In the back, behind you, Stacy.
I just got in here, so I don't know if you covered this or not, but I understand that you're talking about people with disability. I have someone in my family that's disabled also, and they they require like a caregiver most of the time. And as family members, like, how do we deal with a disabled person? Because a lot of times we don't discuss how the issues reflect family members. We only discuss how it reflects the individual itself. So how do the family members deal with the disabled person, especially when they're somewhat 100 or 80 to 70% disabled?
It's extremely difficult. It's in fact extremely tiring for family and for caregivers. In terms of, and I'll just use myself, with my disability in terms of my knees, it just means that there are some limitations that I have in terms of how much I'm going to do at one time. So while I might be able to function, let's say I worked standing for an hour, I might have to rest after that hour and let somebody else complete that particular task. So for caregivers, what you learn to do is to be able to say, I can do so much, but I can't go any farther. Because sometimes caregivers are expected to do more than the person with the disability has. And so you a lot of times have to allow the disabled to do as much as they can do for themselves, and then the caregiver gives the assistance, but they don't do everything. The other thing is to say what you can do and what you can't do. In many instances, if you have someone that's 70 to 80 to 100% disabled, you're going to have to look for services, volunteers to assist you, whether that be from your church, whether that be from the neighborhood, community services, Hope Network, other places that you might be able to go to get assistance, or at least, if nothing else, to get a break. Okay? I mean, if you're dealing with a person that's disabled and they're 100% disabled, and you have to deal with them on a regular basis, every day, all day, and your sleep might be broken, et cetera, you might need somebody to come in and relieve you just so you can get a shower or take a bath or go to the grocery store or whatever it is, so that you can have some free time on your own. And there are community resources that are out there that can assist you in terms of caretaking, because it's a full-time job dealing with a person that is disabled, full-time. I'll give you an example. A friend of mine had a colostomy, okay? And they have a bag that you carry on the side of them, and that bag has to be changed. So every now and then, you've got to actually take that bag off, replace the new bag, and it doesn't smell real good because they've had to reroute their intestines so it comes out into the bag. That's a lot of work for someone. And depending upon what their age is, okay, it's going to be very difficult, or it can be. And so what you want to try to do is to get as much help as possible from any of the resources that I've mentioned so far. I hope I've answered your question. Any other questions? Any other questions? Speak now, forever hold your peace. None? All right, thank you for coming. I sure appreciate it.